what we wanted to do for the whole of our events, for the 3 themes, was to, at the end of when all of the speakers have presented, was to just have a quick wrap up and to discuss what we thought were the calls to action. A number of you came up with your own specific ideas. But again, in this context of the Summit of the Future next year for the UN, what did we think were those calls to action? So I'm just going to ask everyone just to fire in, and as I don't mind who starts or where we go or how this plays out. But we've got 15 minutes, so it's off and go. So what do people think?
It looks like everyone's looking at me. Got it. So I think for me, what is critically important as we move forward is that we make sure that in every conversation we're bringing the community and the people into the discussion. Oftentimes, as we represent the institutions, the organizations, whether it's at the local level, at the national level, even at the global level, we come with our book knowledge of what we believe will work. And it's critically important that we bring the voices of the people to even these conversations so that we can share and understand and dialogue about what are the unique characteristics that we have to take into consideration as we've designed, what works. So I think the takeaway is make sure that you're speaking of the people, informed by the people, in order to bring the work that is intended for the people.
That makes perfect sense. Anyone else want to go before I start prompting?
Sure, it's easy enough. High quality clinical research, bring people on your team that understand how to design studies and how to make sure that you do high quality clinical research during your journey, and then pay attention to digital twins. That's going to be an important part of our future.
Do you think then, Joe, that it's incumbent on healthcare to actually start to educate, if you like, tech about the requirement for evidence, so that actually they start to understand where the elephant traps are, if you like, so that we actually try to foster the literacy around the need for evidence?
I do, and just to sort of underscore that, though, no matter how scientific you are, how intellectual you are, we're all subject to these biases that I talked about. And so someone who's a good talker can talk you into anything. So just remember to be thoughtful about this and to ask the right questions of people, because I'll just, a quick example, I was asked to review some research for a reporter the other day that was talking about the use of telehealth and the fact that in this particular study, they found that it was billed at a less, there was less billing per unit of service than in the office. They're trying to make a big deal out of that, and they asked me about it. And the difference was like 7% to 10%. And I don't know in that sample whether that's a meaningful difference or not. And nobody gave, there was no stats about it at all. Just that, well, 7% did this and 10% that. So that's the kind of thing, just think critically about stuff like that.
Yeah,
Marius,
maybe I think it's very important. We cannot afford as individuals, as families, societies, economies, health system, we cannot afford to wait for the people to become sick and then to spend a lot of money to diagnose and to treat them well and try to make them have again a good life and so on. And that's why I think it's important is not just about speaking about prevention. It's about doing something concrete in order to move from the current status to a new model. Because we are actually discussing a new model that, and I explained that should be human-centric. I think is no-brainer that should be data-driven, and there are a lot of data already available that, but not used, are other data that can be easily generated, but we do not think that are useful, right? And we've discussed about the social data, economic data, individual behavior, value-related data, and so on. So this is, I think, very important. It's not up to one institution or one individual or 10 individuals to move things, but this requires a larger collaboration.
And I know that in the ECHAlliance we have a phrase where we talk about healthcare knows no borders. And today we've talked about different continents, different countries and initiatives, and the need to share best practice. We actually somehow tangibly need much more working together on implementation around the globe than has existed up to date. And what I'm hoping is that people who are listening online, people who are in the room with us, actually understand and think, actually, I can go and talk to that person. I can suggest that we could help with whatever it is. So we just need to get to the stage where we encourage more and more people to actually work together to solve the problems.
Yeah, absolutely agree. I think that the speed of adoption of all the new technologies that we have available right now, it needs to be increased. Many times we are thinking about medicine in a format that used to be like 20, 30 years ago. And looking at all the new technologies, language models, genomics, wearables, and all that, there's a need of reshaping our thinking and how we are going to really deploy all these technologies in the field. And one of the key concepts for that is collaboration. Definitely, you can't do that alone. The old model of large company building their own data without collaborating, without really going deep into communities, without sharing data, without adopting free open source softwares and so on, it's not imaginable. We need to really stress the needs of adopting this technology as soon as possible, because essentially they will make a huge change on how we detect the diseases, particularly as we talked with Marius, cardiovascular diseases, which is probably the main problem that we have. And it's key, the early detection. The only way will be applying all these technologies.
Yeah, and I would love to see Marius's call for cardiovascular health and for the code to take off, so that in a year's time, we're sitting here, we have at least a draft code, we have some tangible actions set out for what that might look like, recognizing that it will be picking up screening, it will be picking up vaccination in different areas, and that together, that's something that tangible that could come out from our discussions today, as well as things like what data is missing, which was coming out. And I was really struck again by when you go around the world and you work with different health systems, everyone, their first sort of request is, I want more money. And we all know about the cost of healthcare and how that's not sustainable. So it's really fascinating with Aisha's comment about nurses as an underused resource, and the ability to be able to actually you tap into that unutilized resource or underused resource for some of the implementation things that we're beginning to talk and tease out during this morning's session. Do we all think that we support that in terms of underutilized resource?
Yeah, I think absolutely. And to be able to really mobilize effective intervention, it really requires multiple stakeholders, grassroots and leadership. Just want to echo Admiral mix in terms of the stakeholders, like understanding where all the stakeholders and the champion. I think you need someone who can really lead and drive the efforts with coordination, and also to touch on evidence-based implementation. I really like that. I think that speaks to the importance of research methodology, the data integrity, where you collect data, how you collect, and the implementation needs to be evidence-based. You need to implement something that you know can make a difference, can make an impact. So I just want to add those two to the table.
Great. And it seems to me that from what we're talking about, we can see an agenda on implementation for the the summit of the future. So rather than talking about more policy or what to do, actually focus on, okay, there's lots of policy that is evidence-based. There's lots of good things that we should be doing. So let's get on and do it. Does that sound, yeah, we all in agreement? Good, I like that. And what about this? What do people feel about this? We've heard different words, which I alluded to earlier, about partnership and collaboration between industry, between academia and research. Do we think that how do we prime that? How do we build the relationships that we need to make this work so we have win-win activities rather than lose-lose silos? Do we support that sort of concept? Do we think there's mileage in that?
Yeah, maybe I can comment on this. And I think we should start, to have a real partnership with the patients and with the citizen in order to, to understand the real needs and to put these needs actually from the beginning in the design of a clinical trial, in the design of an economic analysis, and maybe I will refer to this as well, in the design of prevention, health system design, and so on. And on economics, I think we are now in the position, and in your presentation, Joseph, you mentioned that the way the clinical trials are done is based on one, let's say, interventional product. But now with the innovations and the developments in the genomics, maybe if we will include other data, we should actually assess not just the product, but also the services around the diagnosis and so on. And this is a totally different story in terms of methodology. I'm not a health economist, but I try to understand how complex it is actually to move from assessing one intervention to a multitude of interventions that are different case by case. And one more thing, I think we should move from the current way of assessing the value of an intervention and to move to a societal and maybe broad economic perspective, being able to show the benefits from a societal perspective of an intervention.
And I think what I would add is that, we have to get curious, right? We have to really understand and accept that we don't know everything. None of us knows everything. And so there is an opportunity for us to humble ourselves and use humility to reach out to other partners to understand different perspectives. Because I think that we've gotten to a point where we can agree on these mutual goals, but somehow we come to the conversation believing that our way is the best way to achieve the goal. And so if you get curious and you really want to explore what you don't know, I think that's what opens up partnerships. Because at that point, you have an opportunity to invite someone in and welcome their perspective as opposed to automatically challenging it from out the gate. And so I think that that's always going to be the way to open the door for partnership and collaboration. And so then you move the competition out of the way, because as was mentioned, ultimately, the goal is the people and improved health across the world. And if we can at least agree on that, any conversation can move things forward.
I was going to say that the main stakeholder of this is the subject, the patient. And actually, many times it's not a patient, because he's going to be, or she is going to be sick in, 10, 20 years. So it's a healthy subject that should be involved in all these. Actually, we are physicians, nurses, and government talking about how to deal with these problems, how to prevent them. But the main stakeholder is the subject that should be involved in some way or another. And that's a challenge, because usually, you have, patients, organizations, advocacy for familial hypercholesterolemia. But the healthy, normal subject is usually, I would say, underrepresented. Nobody's here to talk about them. Because they are good, and actually they feel well, they don't have any troubles, but maybe we should look for them, open their eyes, because definitely the communities there, definitely they are going to have the problems, and they represent the future. should get them involved, and they are not here.
Yeah, I actually want to second that. And I was actually thinking about the power of healthcare consumers and how much the social mobilization or campaign and patient advocacy plays a really important role in preventive services and actions. So I think they should be important stakeholder as well.
Yeah, I think we all agree on that, don't we? I think the challenge sometimes is that you get expert patients who don't necessarily represent the average patient who isn't well informed, doesn't have an interest in something, let's say, and it's how do we get their involvement as much as we get the really engaged expert patient in particular conditions. The challenge I have to you as we wrap up is, I think this is incredibly rich content that we've been discussing. So what I'd like to propose is that each of you swaps your details with everybody else sitting up here. And actually what we say is we're going to help each other. So whatever that may be, whenever you need a request or you need some information or you want to work with someone, that we start by doing the little things, which is that we can control that. We can actually reach out to each other. We can help one another. So we start that as a little community between ourselves. And hopefully for those people who are out there who want to connect with you, they can do that through us as well. So thank you all very much. And if we can show some appreciation to this morning's speakers. Thank you.